Did you know gabapentin was originally approved by the FDA to treat seizure disorders, but research has shown it to be effective for anxiety, insomnia, and more importantly, alcohol use disorders. In recent years, evidence has been mounting for its effectiveness in treating alcohol use disorders. And more importantly, in 2014, a study showed that gabapentin was shown to increase rates of abstinence in regards to drinking, decrease rates of binge drinking, decrease the number of drinks per week, reduce cravings, improve sleep, and even if this was with the presence of alcohol, and lastly, improve mood disturbances associated with long-term alcohol use. What is going on, everyone? This is Adam back again with your daily dose of mental health, and in this video today we will be discussing gabapentin and how studies have shown that how it has helped with alcoholism for alcoholics. Once again, please like and subscribe to the channel, hit that bell icon, and please leave a comment on a topic you want me to cover, or just if you're struggling or you know somebody who's struggling with alcoholism or alcohol use disorder. Once again, I love you all. Let's jump right on into this video. All right, so as stated above, gabapentin for alcoholism. Gabapentin was originally approved by the FDA to treat seizure disorders, but research has recently shown, and it started in 2014, that it is effective in treating insomnia, anxiety, and alcohol use disorder. We will briefly cover insomnia, anxiety, but the main point of this is for alcoholism. That's the main objective I'm trying to get across. And we'll review a couple studies as well. So here's some notes I jotted down. Gabapentin was originally once again approved by the FDA to treat seizure disorders. It has also been found to be effective for a number of disorders in neurology, including neuropathic pain, which I see clients getting it, they use that a lot in the psych setting as well, or medical setting, fibromyalgia, restless leg syndrome in psychiatry, which once again I work in psych, insomnia and anxiety disorders. I've seen it. It has a broad spectrum of effects for gabapentin. However, though, as stated, in recent years, there has been mounting evidence for its effectiveness in treating alcohol use disorders, which is a big step in the right direction with the increase in alcoholism or alcohol use disorders we have currently. So, in the 2014 study, as stated, again, that it did help with increased rates of abstinence, decreased rates in binge drinking, which is huge, reduce cravings, which is big, improve sleep, and improve mood disturbances associated with alcohol use, which is big. A lot of times when somebody would relapse as well, it's because their GABA in their brain is it fluctuates so much, and it can be depleted to where that is what it can cause those seizures and those relapses. And I'll get into how gabapentin helps with the GABA receptor in your brain. So, at first glance, it might seem surprising that gabapentin would help treat alcohol addiction, given its benefits for seemingly unrelated disorders. Because a lot of times, anxiety, depression, a lot of times that's what people drink, for example. So in order to understand why this makes sense from a pharmacological standpoint, it is helpful to know a little bit more about how the brain works, which we will get into, and how alcohol affects the brain and how gabapentin works. I'm trying to break this down as easy as I can so it's easy for everyone to understand. Unlike drugs such as opiates, cannabis, nicotine, and even cocaine, there are no specific receptors in our brains for alcohol. So, as stated, for opiates, cannabis, nicotine, cocaine, those attached to your dopamine receptors. So essentially, we do not have alcohol receptors in our brain. Instead, alcohol affects a wide range of other receptors, each having specific effects on our behavior and, more importantly, our cognition. The most important of this being, which would be glutamate and GABA. However, for example, dopamine, serotonin are receptors that can be affected as well. But the most relevant receptor to gabapentin is GABA, which is a neurological inhibitor. So causes depression, like the depressive feeling, that relaxed feeling. It's not a stimulant feeling. So let me real quick summarize it in this way, or help you think about it in this way. An easy way to think about inhibitors is that they function as brakes for neural impulses. They slow things down and decrease communication among cells. When you drink, for example, the primary effect is initially slowing down your brain function, help relaxing as stated. These inhibitory neurotransmitters underlie the familiar signs of intoxication, which include drowsiness, decreased attention, poor memory, and confusion. So, given sufficient amounts of alcohol, the user could lose consciousness and even stop breathing and die. That's one thing. Alcohol is one thing. If you drink too much of it, you're toast. Liver failure, you go into respiratory depression, and you can pass. And a lot of times people will mix them with other depressants, like benzos. So, real quick, this is another part I want to go into, titled Maintaining the Status Quo. One of our body's primary survival strategies is called homeostasis, and that's how we keep our body in check. So for example, let's say your temperature, average temperature, let's say your temperature is 98.6 and you're starting to feel sick, and it goes up to 100, 101. Your body's out of homeostasis, so it's going to try to go back down to that 98.6, that average range. So homeostasis, really in Latin means the same state. Whenever an environmental change is applied to the body responds to offset this and keep conditions exactly as they are. Common examples include sweating when the body gets too warm, which is thermoregulation, and frequent urination if excessive water is consumed. The brain responds in a similar way to chronic alcohol exposure. When excessive amounts of an inhibitory neurotransmitter, which I like to call a brake, as we said, such as GABA, the main one involved, is activated because of alcohol use, the brain counters this by reducing the number of receptors or the sensitivity of these receptors. It attempts to reestablish equilibrium by offsetting GABA's inhibition. The brain presses the gas pedal. Okay, and that was just kind of an example of it. But when the chronic use of alcohol stops and the brake is removed, all that remains is the pressed gas pedal, and the brain is suddenly left in a hyper-aroused characterized state, which the characterized state meaning you'll have signs and symptoms such as anxiety, insomnia, agitation, and in severe cases, as we've discussed in the past with benzos and other alcohol videos, seizures. So that was just a little background on how alcohol works. Before I go any further, please like and subscribe to the channel, leave a comment, and if you're watching up to this point, I greatly appreciate it. You'll check out some of my other videos. I cover a wide variety of videos, everything mental health, from drugs, my own recovery, motivation, everything. It's called The Daily Dose of Mental Health. Just check it out. So, back to the video. How gabapentin works now. This is where gabapentin enters the picture. Although it is not exactly known how gabapentin affects GABA, it is generally agreed that it directly or even indirectly increases the availability of GABA in the brain. In other words, it has something in common with alcohol. Now you might be thinking, would that be bad? Something in common with alcohol. Is that replacing one thing for another? But let's think about it. Let's pause real quick. Through its effects on GABA, gabapentin calms down the brain, which is exactly what is needed for that hyper-aroused state of somebody who's sober or going through alcohol detox. So this is believed to result in a reduction in anxiety and improved sleep, both of which are associated with reduced cravings for alcohol. So also some safety and side effects of gabapentin, which I always like to go into side effects of anything, because everything has side effects. So first, gabapentin is generally well tolerated, with dizziness and peripheral edema being the most common side effects. So once again, dizziness and peripheral edema are the most common side effects, which you might be thinking, oh, I don't want to do that. But most substances have side effects that can be like this or even worse. Also, it is not a controlled substance. I did a video, which check out, Lyrica versus gabapentin, why Lyrica is controlled and why gabapentin is not. I will, at the very end of the video, if you watch till the end, I'll put that video there that you can instantly click on. Beyond its ability to reduce drinking and improve secondary symptoms associated with alcohol dependence, there are specific characteristics of the medication that make it particularly suited to helping the problem of drinking, which include: it has no dangerous interactions with alcohol, which that's huge, unlike benzos. It is not metabolized by the liver. And be real quick, I want to back up on this. So let's say you're in alcohol detox and you relapse on alcohol and you're prescribed benzos. If you took those together, that's a depressant and that can kill you and just make it even worse for you. So that's the big thing on why it doesn't have any dangerous interactions with alcohol, gabapentin. Also, it is not metabolized by the liver, giving your liver some time to actually relax and breathe, because alcohol long-term causes a fatty liver. Also, it has no interactions with other medications that treat alcohol dependence or medications that treat depression and anxiety. So two common comorbidities. Now let's go into dosing of gabapentin. Gabapentin has a wide dosing range. For example, for seizures, patients may take up to 4,800 milligrams daily. Typically, in the clinical setting, if somebody's just starting, you put them at 100 milligrams, but you work your way up. So even if it's not for alcohol related, for like neuropathic pain, there are people who take 300 milligrams 3 times a day, 400 3 times a day, or even 600 milligrams 3 times a day, which would be 1,800 milligrams. So, as I said, for seizures, you can take up to 4,800 milligrams a day. For sleep, doses range from anywhere from 300 to 1,800 milligrams at bedtime. This would also include, as I said, for people who have chronic pain. Also, for treatment of alcohol use disorders, typically dosing is used between 900 to 1,800 milligrams. And with most things, the high end I've ever seen in the psychiatric setting for alcohol use disorders, to pain, to anxiety, is typically 900 to 1,800. That's why I was saying 600 milligrams 3 times a day, 1,800 milligrams. That's the highest dose I've seen. Higher doses are often associated with greater benefit. Now, really, depending on the disorder, it really just depends. It really depends on what the prescriber is wanting to do, depending on your situation. Real quick, one thing, gabapentin treatment for alcohol dependence. There was a randomized controlled trial, and I want to just go over this briefly. So this is a study. In the importance of this, approved medications for alcohol dependence are prescribed for fewer than 9% of alcoholics, which that is huge. That's why I'm doing this video. That's why gabapentin should be utilized more for alcohol use disorder. And also, for this study, the objective was to determine if gabapentin, a widely prescribed generic calcium channel blocker, which Gaba, which is a modulating medication, increases rates of sustained abstinence and no heavy drinking, and decreases alcohol-related insomnia, dysphoria, and also cravings. There were a few more, but I just didn't list all of them. These are the main ones. In a dose-dependent manner. So the design of this study, participants there were participants and they're in a setting. So this was a 12-week double-blind placebo-controlled randomized dose-ranging trial of 150 men and women over 18 years of age with current alcohol dependence, and conducted from 2004 to 2010 at a single outpatient site in a clinical research facility adjoining a general medical hospital, which is smart, just in case something does go wrong. So real quick, some interventions. Oral gabapentin, 0 to 900 to 1800 milligrams, were typically the guides for how they were dosing. So the main outcomes of the measures were rates of complete abstinence and no heavy drinking, which was a co-primary, and changes in mood, sleep. Were changes in mood and sleep and craving, which is a secondary outcome. And this was over that 12-week study. Also, another part, gabapentin combined with naltrexone for treatment of alcohol dependence. This is the other study I want to go into, so please try to follow. So the second one is gabapentin combined with naltrexone, which naltrexone Revia is a medication used to decrease cravings for treatment of alcohol dependence. So the objective of this study was naltrexone, which Revia is a medication used for people who have cravings or alcohol dependence, and this medication does not work for everyone. So real quick, symptoms such as insomnia and mood instability that are most evident during early abstinence might respond better to a different pharmacology therapy, which is true. Not everyone responds the same way. This is why you need multiple studies for different medications. However, gabapentin may reduce these symptoms and help prevent early relapse. The clinical trial evaluated whether the combination of naltrexone and gabapentin was better than naltrexone alone or the placebo during the early drinking cessation phase, which would be the first 6 weeks, and if so, whether this effect persisted. So that's what they were looking into. Real quick, the method. A total of 150 alcohol-dependent individuals were randomly assigned to this 16-week course of naltrexone alone or naltrexone and gabapentin. So either one of those groups. The dose of naltrexone is typically 50 milligrams a day, just so you know. And if they were giving gabapentin with it, it'd be 1,200 milligrams a day. So this was for the first 6 weeks of this double placebo. All participants received some sort of medical management. So there's really no placebo where they're not getting anything. So this is the thing, results of this. During the first 6 weeks, the naltrexone gabapentin group had a longer interval to heavy drinking than the naltrexone alone, which is big, showing again gabapentin works, but you can use other things with it, which had an interval similar to that of the placebo group, which once again, placebo being in this one, naltrexone alone. So also real quick, there were fewer heavy drinking days than the naltrexone alone group, which in turn had more than the placebo group and had fewer drinks per drinking day than the naltrexone alone group and the placebo group. So these differences faded over the remaining weeks of the study. Poor sleep was associated with more drinking in the naltrexone alone group, but not in the naltrexone gabapentin group. So in these two groups, once again, it's showing you either got naltrexone or naltrexone and gabapentin together, and it's showing the whole key of why I'm telling you about this is gabapentin alone or gabapentin with naltrexone in either of these studies is helping people stay sober and helping with the side effects of alcohol use disorder. So while a history of alcohol withdrawal was associated with better response in the naltrexone gabapentin group, this essentially shows that if you're given gabapentin and naltrexone together compared to naltrexone alone, and this once again can be subjective from person to person, it is shown that gabapentin added with naltrexone, known as Revia, which decreases cravings, you have a far better chance of actually staying sober long term. So the conclusions: the addition of gabapentin to naltrexone improved drinking outcomes over naltrexone alone, which I just said, during the first 6 weeks. after cessation of drinking. This effect did not endure after gabapentin was discontinued. So this effect did not endure after gabapentin was discontinued. Okay, so that'll conclude this video. And once again, I just wanted to cover this to show that if you're suffering with alcohol use disorder, or if you're an alcoholic, there are treatments out there. Just go, if you can, go to your primary care provider and ask them, hey, can I try gabapentin? Can I try naltrexone? If you've tried naltrexone and it has not worked, maybe in conjunction with something like gabapentin can help you. That's why I'm presenting some of these studies to you. But we need more people out there, and we need more studies and doctors to understand that somebody who's going through alcohol use disorder, they need to understand that there are treatments out there that can be successful. And I truthfully believe in the next 10 years or so, if doctors, nurse practitioners, and even nurses can educate patients on these studies. I am an RN, and I try to educate them as much as I can. I'm not a doctor, but I can educate. I can't give medical advice, but I can educate. I'm hoping that in the future that we can provide more treatments and show them that if you do fail, let's say you do relapse, there is still hope. There are other treatments. There's more things than just AA or NA out there. But once again, thank you for checking out this video. This is your daily dose of mental health with Adam. Also, I will provide at the very end of this video the Lyrica gabapentin video that talks about the differences, why one is controlled and why one isn't. So you can check out that. I also have a couple other alcohol-related videos that I'll post as well. But once again, please like and subscribe. Leave a comment if this helped you, if there's something you want me to cover, anything like that, because I will. I don't know quite yet what my next video will be about. I'm working on one currently on psychedelics, just to let you know, and how that correlates and relates to helping people who have PTSD. I also just did a video on ketamine and how that is helping people with major depressive disorder. Thanks again. Thank you for watching this video. I love you all. Please like and subscribe to the channel and leave a comment.